Hello, I am student UAID 31223057, and this is my presentation on the topic of the impact of COVID-19 on the U.S. population according to the three population determinants: births, deaths, and migration. The components of my discussion, I will start with the background of COVID-19 and populations, especially population trends in the United States. Reason for exploration of this topic, the sources of information I used to study this topic, discussion of my research findings, and I will end with a conclusion. The coronavirus disease 2019, or COVID-19, has impacted nearly every population on Earth. Originating in China and quickly spreading across the globe, COVID-19 virtually stopped the world in 2020. Economies ground to a halt and entire nations shut down in quarantine. The high infectivity of the virus, combined with its devastating effect on vulnerable populations, made understanding the nature of COVID-19 paramount. Although much focus was given over to medical research and economic discussion, it is just as important to evaluate the extent to which COVID-19 has impacted populations. Many developed countries, such as Korea, China, and Russia, are on the precipice of experiencing population crises. The United States is no exception, and while the country has been experiencing population decline for several decades, COVID-19 is clearly exacerbating this downward spiral. To better understand the impact COVID-19 has had on the U.S. population, historical trends must also be considered to provide a more complete picture. A population, according to demographers, is made up of three determinants: births, deaths, and migration. Prior to the COVID-19 pandemic, the U.S. was already experiencing a decrease in rate of births, which reflects the number of childbearing women and their preference for childbirth. This decline, calculated as total fertility rate, which accounts for age variability in fertility, has fallen below the level necessary to maintain a stable population. One of the major factors for this decline is higher per capita income, which provides more women access to education and birth control. And though the death rate has fallen in recent decades, the number of deaths continue to grow as more of the baby boomer population enters retirement and lives out their lives. This also means the population is getting older. This factor is important because the number and causes of death, as well as reported errors in cause of death, have obscured the impact of COVID-19 on U.S. mortality rates. Finally, net migration, the number of in-migrants minus the number of out-migrants, had been significantly reduced prior to the onset of the pandemic. The Trump administration had already enacted executive policies which dramatically reduced net migration in 2019 and 2020. A reversal of these policies could improve the current net migration status as students and migrant workers return to the U.S. The U.S. population was already experiencing a downward spiral prior to the arrival of the COVID-19 pandemic. Fewer births related to historical socioeconomic changes in the U.S. culture reduced the rate at which the native population replenished itself. And though modern medicine reduced mortality, a larger generation of Americans began to enter retirement and old age, increasing the number of deaths significantly. Finally, migration, especially international migration, which is the easiest means for a country to manage its population, has fallen significantly due to recent presidential administrative policies. This downward spiral will eventually spell disaster for the Social Security, Medicare, and other government assistance programs when those dependent on these programs far outnumber the taxpayer base supporting them. That is, unless some measures are taken to rectify the state of affairs, demographically speaking. COVID-19 remains a relevant topic in daily life and for study in several fields of research such as medicine and demography, which can shape policies. This is not surprising when COVID-19 also persists as a threat to public health and safety, despite differences in position among U.S. leadership. In fact, COVID-19 continues to impact populations across the globe, and the long-term effects have yet to be fully realized. The danger of COVID-19 lies in its high infection rate and high mortality rate among susceptible populations, such as the elderly, people who are pregnant, and individuals with pre-existing health concerns such as cancer, diabetes, and respiratory illness. Demographic data can discover trends in cases and deaths for specific populations, such as the before mentioned, which will allow policymakers to create more targeted responses. It is the intent of this research to better understand how the COVID-19 pandemic has affected the U.S. population according to the three demographic parameters for population: birth, death, migration. The sources of information that I used for this research included the CDC COVID data tracker, the National Vital Statistics System, the U.S. Census Bureau, and the UAA APU Consortium Library. Discussion of research findings. Births prior to COVID-19. Prior to the onset of COVID-19 pandemic, fertility rates were already declining in the U.S. This is attributed to the second demographic transition in which changes in society such as increasing age at first marriage, emergence of same-sex marriage, increases in cohabitation and non-marital childbearing, as well as voluntary childlessness contributes to fertility decline. Declining fertility is also associated with higher per capita income, which, in general, means better education and employment opportunities for women, as well as access to birth control. Although the before mentioned may be interpreted as positive changes to a society, equity, and improved standards of living, because the total fertility rate has remained below the requisite 2.1 level to stabilize the population, there is the risk that the United States fertility rate will drop to such an extent that the number of deaths exceeds the number of births. As of 2020, the U.S. reported over 3.6 million births, which exceeds reported mortality at 3.3 million. Furthermore, with the reduction in number of births, the population of the U.S. will start to become older and outnumber a dwindling workforce. This means added financial pressure on taxpayers who must support a larger population dependent on government assistance and Social Security programs. With this in mind, let us now consider the implications of a pandemic on a declining fertility rate. COVID-19 has complicated the matter with a significant drop in fertility rates that cannot be explained by seasonality, that is, the flux in fertility rates related to seasonal changes, or it cannot be explained by prevailing trends. In December 2020, there were 7.66% fewer births than in 2019, or about 763 fewer births each day in December 2020 compared to 2019. This difference between 2020 and 2019 continues throughout the year, resulting in an approximate 40,000 missing births. Although data shows that COVID-19 has contributed to the reduced fertility rate during the pandemic, more data is needed to determine exactly how COVID-19 has impacted these births. It is plausible to suggest that COVID-19 may be affecting conceptions not being carried to term, or that the nationwide shutdown may have had some role to play as people were less able to socialize or enter relationships resulting in conception. Whatever the reason, it is clear that COVID-19 has had some exacerbating effect on declining fertility rates, although it is unclear what exact ways these effects have manifested. Deaths prior to the COVID-19 pandemic. Although mortality has been declining in the U.S. due to factors such as improved healthcare and advances in medicine, the number of deaths has been increasing due to the aging baby boomer generation. As a group of people grow older, physiological decline begins to set in and various diseases begin to take their toll. In 2019, the leading causes of death included heart disease, cancer, chronic lower respiratory disease, diabetes, and kidney-related illness. These causes of death make up nearly 55% of the total number of deaths in 2019. Other leading causes of death not related to illness included accidents and intentional self-harm. In some cases, additional deaths may be attributed to individuals delaying or not seeking treatment. Many of the before-mentioned illnesses are age-related or do not tend to develop until later in life. Diabetes and heart disease was some of the most common causes of death in individuals 65 years and older. Thus, with the baby boomer population entering these later stages ridden with life-threatening illnesses, it is only natural to presume that the number of deaths should be on the rise. Besides advances in healthcare and medicine, there is little that policymakers can ethically do to alter mortality rates. How then might the U.S. respond to COVID-19 and the inevitable positive surge in mortality rates? Mortality rates surged at the height of the COVID-19 pandemic. As of November 2021, there have been a total of 770,461 deaths in the U.S. In 2020, there was over 375,000 deaths directly at 83%, or indirectly at 17%, attributed to COVID-19, which constituted an age-adjusted increase in death rate by nearly 16%. Due to the nature of the virus and its similarity to other viruses such as influenza in terms of symptoms, accurate reporting of COVID-19 related and non-related deaths can be difficult to obtain. A popular means of determining a closer estimate of COVID-related deaths is excess mortality. Excess mortality is useful because it quantifies deaths relative to recent years, and it can incorporate deaths due to COVID-19, deaths in which COVID-19 is not diagnosed, and indirect deaths due to COVID-19. However, this does not account for population changes, such as major age transitions due to the aging of the baby boomer generation. Accounting for these age-related changes in the population, one study showed that a closer estimate between the months March and August 2020 was substantially less. The usual method of using excess methods estimated approximately 300,000 COVID-19 related deaths before the before-mentioned 6-month timeline, while the age-adjusted method calculated an estimated 218,000 deaths. While this is still a substantial number, the difference is considerable and requires that a closer examination is made to achieve better accuracy. Having a better understanding of the extent to which COVID-19 has truly swollen the mortality rate will allow policymakers and healthcare professionals to target vulnerable populations most inclined to perish to the virus or other viruses. Migration prior to the COVID-19 pandemic. Under the Trump administration, international migration dropped significantly as the number of students and migrant workers permitted into the country was reduced. With the decline of births and increase in deaths, the U.S. faces a population crisis within its native population. To support an aging population, the taxpayer base will experience increased financial pressure unless international migrants are invited once more back into the country. According to the demographic transition theory, migration is likely the best way for a country in stage 4, like the U.S., to stabilize its population. The resulting radical change in population ancestry is referred to as a third demographic transition. Of course, without a migration policy that survives multiple presidential administrations, it is not likely that international migration will be enough to supplement the native population, let alone radically alter its ancestry. Other problems that will stem from an aging population with a dwindling workforce is a reduced state of dynamism and innovation in the economy, as well as a strain on public finances like those that support retirees. However, an influx of international migrants means an enlarged workforce and a reinforced tax base to relieve some of the pressure on the native population. Furthermore, with many migrants being accepted, the U.S. will have the ability to be selective of its applicants, choosing those who bring much-needed skills or training. However, between the Trump administration and COVID-19, international immigration to the U.S. has been significantly reduced. Approximately 2 million fewer visas were granted in 2019 as compared to 2016 when Trump became president. With the onset of COVID-19, borders were closed and the data for 2020 has not yet been released, although it would seem the pandemic has coincided with a sharp decline in net migration, and this goes the world over. Although international migration declined rapidly, there are some signs of internal migration within the U.S. The pandemic stimulated a small movement of people from large urban centers to suburbs or more rural locales. This is referred to as flight from density, and it is not typically a permanent state such that when high-density urban areas are considered safe again and jobs are once more available, people will move once more to these areas. This is not true for all urban areas, as there is also movement of people south and east, away from the Northeast and Midwest. Thus, some urban areas experience a swelling of the population regardless of the state of the pandemic. The conclusion of this research. It is important to understand how a pandemic, especially one that involves a highly infectious respiratory illness, can change a population, but to truly understand its impact, some understanding of the population's current trends must be obtained. This is true whenever one wishes to understand the state of a thing. First, you must obtain knowledge on the preceding state or nature of said thing, then account for the changes wrought by the introduced variable. Only thus can meaningful insight be made about impact. As was discussed, the U.S. population was already experiencing a negative population trend in which the rate of births was down, the number of deaths was increasing, and migration was stymied by executive order. The U.S. is experiencing stage 4 of the demographic transition theory, in which both fertility and mortality rate are low, and the only way to truly grow the population is with a major increase in fertility, such as the baby boom, or an influx of international migrants. With the onset of the COVID-19 pandemic, fertility was shown to have dropped and mortality increased, and with the borders closed during the peak of the pandemic, migration dropped to its lowest point in 30 years. In fact, in 2019-2020, the U.S. growth rate was the lowest in at least a century, a culmination of a population trending toward decline and onset of pandemic upset. With the added pressure to population stability applied by COVID-19, the rapid pace at which the U.S. will have to confront looming socioeconomic issues increases. When research to determine the impact of COVID-19 on U.S. population began, it was assumed that there would be significant signs showing the devastating effects of the pandemic. In some cases, there were clear signs of COVID-19 inflating rates, such as mortality, or deflating, such as international migration. It was not exactly clear in what way the pandemic impacted births, but the data indicates that there was some effect had in 2020. Further research is needed to better understand how fertility rate has been impacted by the COVID-19 pandemic. Once the data for migration in 2020 is released, it will be interesting to examine the trends in international migration as well as the rate and flow of internal migration. Reporting accuracy is important for monitoring COVID-19 related deaths to prevent any surges in vulnerable populations. While expectations differed from results, it is interesting to develop a truer grasp of the implications of a pandemic on a modern population. Thank you for listening to this presentation.